at the age groups is that we're very much tilted towards a senior veteran population. Currently, veterans age 65 plus is 52%, and right behind them is a whole other group of Vietnam. So one of the things I want to, just to kind of, you know, about 1 in 10 Oregonians is a veteran. But when we talk about our older veterans above 65, there's a good chance that maybe 1 in 3 are veterans that you might meet in the older populations, and that's because World War II and Korea and in the interim between that and Vietnam is that there was a draft, so a lot more people served back then. So as you can see, the need for aging veteran services is pretty high in our state. And we're higher than the national average as far as age-wise of our overall age population of our veterans. So, and there's a little bit better breakdown of the slide and about our veteran populations. So today we're going to talk just a little bit about military service, discharge documentation, and then we'll get into the VA benefits. So just some general military knowledge. I have no idea of who's in my audience as far as what they've done and or if they've served in the military. One of the things we'd like to always ask is that we've kind of stopped asking people if they're veterans and just ask a simple question: have you served in the military? We get a better response, and most of these benefits are around people who served in the armed services, and that's the Army, Navy, Marines, Air Force, and the Coast Guard. So, and a veteran can serve during wartime, peacetime, and may or may not have combat experience. So is serving and having the appropriate discharge, which I'm going to turn over, is that the discharge documents is really one of the most important documents that the federal VA needs and other entities need to establish veterans status, basically. That discharge document is called a DD-214. But however, prior to 1950, it was called a Notice of Separation from Active Duty or Active Service, and each service had their own version of that. So finally, our Department of Defense got it right, and it's a standardized form for everybody. That every veteran, especially the newer ones, have multiple copies created, and the newer veterans since 78, 79, is that we actually get a copy of that comes to the State Department of Veterans Affairs, and the service member gets a couple copies of that. And if they don't have their copy, is that you can get a replacement for it in some fashion. There's a National Archives that will help us out. Character of discharge is critically important, is that there's multiple different characters of discharge, which really base whether or not a veteran is eligible for benefits. The honorable discharge is what most veterans get, which is good for any benefit that allows them qualifications for any benefit. A general discharge is good for most benefits, and that means that their service, they might have had a problem or two, but general discharge is good for most benefits. But just below general benefits is the other than honorable, bad conduct, and dishonorable. Those last 3 discharges are a bar to any veteran's benefits. There is not much that you can do for anybody who has a discharge, a character of discharge in that fashion. We can look at and see if there's a possibility for getting that changed, but they're very, very hard to change just on the surface. So we're going to look at the four major benefits that veterans get, and we're going to start with service-connected compensation, and we're going to go through that, and this is a very the most uh, prevalent benefit that we see. Just for your information, um, in the state of Oregon, the service-connected compensation monetary benefit included with the non-service-connected pension last year was $1.4 billion that flowed into our state. So, and when you include health care and survivors benefits, it's $1.97 billion every year that comes into our state for veterans benefits. So it has quite the economic impact, both individually and to our state. So service-connected disability is a monthly payment made to the VA to a veteran for a disability caused or worsened by a personal injury or disease while in service. Is that, and what that means is think of this as a really high-powered workman's comp program. Is that for me, I was in the military for 26 years, and I'm currently 30% service-connected disabled by the VA. And it goes in 10% increments up to 100%. And it has to be, you have to file a formal claim to the federal VA, and it's an evidence-based claim to the federal government saying that the injury or the residuals from a disease or a combat injury is directly related to their service in some fashion. And there's multiple ways to get that. We're going to get into those. So there are 5 ways for a veteran to get service-connected compensation or disability compensation from the federal VA. And this is what our veteran service officers do around the state. Every county has a veteran service office. We do some veteran services work both here in Salem and in Portland. The national service organizations have veteran service officers that help veterans and family members through these claims. So it's a very formal claim process that has a lot of rules and policy that it can be very complicated. But the most common one of all is called direct service connection. And I'll give you an example of myself. In 1990, I was working on an airplane, and that's basically what I did. I was a maintenance person in the Navy, naval aircraft, and I was up on a ladder pretty high, and the ladder slipped, and I fell off the ladder, and I broke my leg, and I hurt my hip, and I broke my wrist really bad. And the resultants of that after I finally got out is that I filed a claim for those injuries because they're currently a disability today. In my case, it's arthritis, and I have limitation of movement in my ankle and my wrist. So, and I also have a really very significant hearing loss from working around airplanes. So those are things that were directly relatable to my military service through medical records, basically. And when I got out, I filed a claim, and then the VA rated each one of those disabilities separate. This is the direct way, and determined that I was 30% disabled overall because of those injuries. So that's basically direct is something that happens to you. Let's say that a veteran was involved in an improvised explosion while they were in Iraq, let's say, and they had a brain injury. Well, that would be a direct service connection because that happened while they were on active duty, and it's directly a resultant of some sort of incident or hospitalization. And it has to be a current disability too. Is that if something happened to me that is resolved itself and it's not a disability today, then there's really no way to claim that with the VA because this is a disability compensation. So the next one I want to talk about is secondary service connection. That is if it's a condition that was caused by a service-connected condition. So a good example of a secondary service connection is that if if I was diagnosed, let's say, with type 2 diabetes while I was in the military, and I got out and I filed a claim for diabetes, but now after a few years I have let's say diabetic neuropathy in my lower legs, which is a very common secondary disease to diabetes. I would be able to get service-connected compensation for neuropathy because that is directly related to my service-connected condition of diabetes. It's a really important. This is a really important way to get service-connected because things, disabilities sometimes stem from other disabilities, and this is a set of laws in the VA in federal law that allows that, and veteran service officers again can help a veteran or their spouse guide them through this process. So, and we do. It takes about a year to get accredited to be a veteran service officer, so it's pretty complicated. An aggravated service condition is that if you join the military because and they knew that you had a previous injury, let's say a veteran was joining and when they were a teenager they broke their leg. Well, if they reported that in the military when you joined said that it's a good to go, it's 100%, then you join the military and through, let's say they do 4 years, is that the military service aggravated that injury, is then you could file for a disability, service-connected disability compensation because it was aggravated due to your military service. The next one, which is another really important one, is presumptive service connection. And this is based on time in service or location or exposure to certain chemicals or radiation. And one of the ones there's really 5 big presumptive service connection areas. One of them is called Agent Orange, and I'm sure that most people that are listening have heard of Agent Orange, and that veterans who served in Vietnam, they have a presumptive exposure to Agent Orange, and then by federal law, there's a very extensive list of diseases that are associated with Agent Orange. That if you should happen to get one of those, diseases diagnosed by them, one of those is that you could get service-connected disability compensation for. And when we talk about Agent Orange, the really common ones are lung cancer, Parkinson's, diabetes, prostate cancer. Those are really, unfortunately, common from that Agent Orange exposure, and the federal law really has a very wide guidance on this. Some of the other ones are if you were a former prisoner of war, there's certain disabilities that are associated with that have, like like it's mental health issues, the a lot of things that due to malnutrition like arthritis and bone misstructure and stuff like that. So presumptive service connections are a really very critical part of this set of laws that, as veteran service officers, we do a lot of claims for these. And the last and the least most prevalent one is what we call 1151 claim, which basically is a malpractice claim against the federal VA for VA health due to VA health care. If anybody's ever knows about that doing it's basically a tort claim against the federal government. It's pretty hard to prove, so we don't see very many of these. But it does allow a veteran who had basically a malpractice against them with VA health care to get service-connected compensation. So one of the things I did not mention, and that I want to talk about just a little bit separately, is mental health issues from stemming from military service, um, and and particularly PTSD. Post-traumatic stress disorder is very prevalent amongst all eras of service. Um, it's in its most prevalent way is that most of the times it's associated with either combat service, a veteran that was exposed to combat, or if it was due to sexual trauma or in the military. And PTSD is a service connectable, just like any mental health is a service connectable um, disability area. And there's some laws that associate with that. Over the years, the federal VA has really worked hard with veterans groups and others that allows a little wider latitude on what constitutes what causes PTSD. What kind of combat, what happened to them, or what happened with them if they were sexually attacked while on active duty. And this was not this prior to 1986. This wasn't PTSD wasn't even a service connectable item because it wasn't recognized by the larger mental health groups and the DSM manual, which is the mental health manual, until about 1986. So veterans prior to that who would come back from active duty in a war zone had all these issues, but let's say, and which is very common, that it could be a year or two or 5 years later down the road where they actually started having the symptomology and the issues that stemmed from PTSD. So this they were just there was just no way that they could get disability compensation prior to that unless they were diagnosed with it while on active duty, which was very rare. So and that would be just a direct service-connected claim that would go up, and we would have to provide evidence and a diagnosis. But for veterans in general, this has been a very positive change because one of the things I'd like to point out about service-connected compensation. So like I said with myself, is that my ankle and my hip and my wrist and basically my hand and my hearing, which is really bad, is that the VA, with that service connection, is obligated to treat me medically for those forever, is that for free of charge. So if a veteran's service connected for PTSD or any mental health, then the VA is always on the hook to, uh, to, to provide priority care to them free of charge. They own, I always say to people, the VA owns my right side of my body and my hearing because they've supplied me with hearing aids. They did an operation on my hand to correct some arthritis that was growing. Is that and it's good health care that is given priority by the VA for service connection. So service-connected disability is really, in our work that we do as advocates, it takes up a large majority of our claims and our time is advocating for veterans in this claim process for service-connected disabilities. A little unusual for me to do a webinar where I can't have questions, but I'm gonna move on to the next area because and I want to before I see somebody's typing a question. Please type away. I'm watching the questions. I'd be glad to answer any questions. But we're going to talk next about non-service connected disability and and everything I just talked about, service-connected compensation. I want you just to kind of put off to one side of the brain for just a minute while we talk about it because they're very separate benefits. So I'd like to answer a question and the question was, if the vet was discharged before 1986, can they now qualify for the PTSD service-connected benefit? The answer is absolutely. Is that if this veteran would have attempted to file a claim before 1986, they would have been denied because there was no statute in the law to do that. But a lot of our claims work is for, I've done PTSD claims for a World War II vet. That law changed in 86, which opened it up for everybody. So that, in that, there's requirements that they would have to meet, like a diagnosis of PTSD and a few other things, but the answer is absolutely. And those are the more common claims than the newer ones. We see a lot of Vietnam era vets that are finally coming, or they retire and they find out that they just need help, or they want to file a claim for PTSD. So I hope I answered your question. So non-service connected pension is, again, this is a different benefit than service-connected compensation. Kind of to answer a question right off the bat, is that a veteran cannot get service-connected disability compensation and non-service connected pension at the same time. However, we could file a claim for both, and the federal VA would give the better benefit of the two. So, but by federal law, they cannot receive both of these benefits. Non-service connected pension is really based on, it's based on criteria, and we're going to go through, kind of breeze through these criteria. This is a fairly complicated benefit, but I will kind of phrase it in a way that makes it understandable. So first of all, they have to serve during a war era. They don't have to serve in combat, but the veteran the veterans who are qualified for this benefit right off the bat, they have to serve during an established war era, and those are established by the federal government, and that means that they have to serve one day during that period of war. And again, that doesn't mean in combat itself. They just have to serve during the era. We currently are in a war era since 1991, so there is a very long war era from 91, and it's still ongoing. World War II was from 1940 to 45. Korea was from 50 to 54, and then the Vietnam era for some veterans started in 61, but for most it started in 1964 to 1975. So, so you'd have to serve honorably during that time, 90 days on active duty prior to 1980, and then after 1980, 24 months of active duty, and during their service time, they had at least one day of that has to be during that established period, that war period. So the next one is that they have to be considered permanently and totally disabled from any condition, and this is what the term non-service connected is. So it's, is that so a newer veteran who, let's say, served in 1992 wanted pension, is that they would probably have the required amount of time in service and period, but they would also, the federal VA would also take a look at them and see if they're permanently and totally disabled from, period. Any kind of disability. It doesn't have to be associated with the military at all. So that's a big deal. However, and this is not to confuse you, is that federal law states that if you're over the age of 65, they basically waive that total disability and say you meet that criteria if you're at the age of 65 or older. So so our older veterans, just by the fact that they're 65 or older, meet that permanently and totally disabled. And then now we get into the more complicated side of non-service connected pension, that they have a net worth requirement. So the VA typically will not approve non-service connected pension if their net worth exceeds $80,000. Okay, and it's also a dollar for dollar benefit. So if they have net worth, and when the VA considers net worth, That's stocks, bonds, savings account, IRAs, things like that. That not your home, though, not the home that you live in. The VA does not consider that net worth unless it has property with it. Um, but the net worth really revolves around like cash assets of some sort. And then this what we're talking about, maximum allowable pension rate for a single veteran right now is about $1,100 a month. It's a little bit more than that, but around, think of it as $1,100 a month. So if a veteran has Social Security, which is accountable income, is that they would take a dollar for every dollar of Social Security away from the pension benefit. So if they had $900 a month coming from Social Security, they would get $200 a month in this non-service connected pension benefit. So as you can see, is that the way this program is structured is that it really keeps veterans at that 1,100 maximum amount. So if they're getting Social Security of $1,300 a month, they would receive nothing from the VA. And unfortunately, if the veteran is married, they consider spousal income as the total income too. So and that also kind of pushes most of the veterans that apply for a pension out of any ability to receive any monetary portion of this. And I flick to the second next page because this is where most veterans are getting non-service connected pension. And I see some questions here.
Yeah,
So,
Mitch, we have a couple
yes.
questions if you'd like me to ask them.
No, I'm looking at them right now.
Oh, okay.
So one of them is, what prescription drug benefits are available to veterans? And the answer is that if the veteran is in VA healthcare, and one of the ways to get in VA healthcare is that you're on pension or service-connected compensation, is that they will, if you have VA healthcare, the the VA's formulary of drugs is available to you. If if your if your if your income is high and it's not a service-connected condition, like for me, my income is fairly decent. I work for the state of Oregon and I have other incomes. The VA could technically charge me $8 for a prescription for a 90-day supply if it's not a prescription for my service-connected conditions. If it's a prescription for my service-connected conditions, it will be totally free. So that's how that works. But you have to be in VA healthcare to do that. VA healthcare, if you're getting service-connected compensation or you have this pension benefit that I'm talking about, you're automatically in VA healthcare. Not every veteran is in VA healthcare because they can't fit all the veterans in our country in. They have a space available that veterans can get in if they have lower income. So that's how it works. But I know that was a long way around to answering your question about prescription drug benefits, but I know that's a very important question that needed some explanation. And the next one is the $80,000 net worth based on spousal net worth too? Yes. If you have a veteran and a spouse and they have together over $80,000 of net worth, it would count against them and they would not be able to get this pension benefit. And that's all the questions for now. So I'd like to continue on into this really important part, which is this aid and attendance. And I know that majority of you have heard of VA aid and attendance. But before we go into this, I want to explain something. Number one is that the aid and attendance benefit is the most misunderstood benefit of all. that I field more questions when I do presentations around the state, is that this is the one thing that that is very confusing. So right off the bat, I want to tell you that aid and attendance benefit is not a standalone benefit. Okay, you have to be eligible for the non-service connected benefit. Okay, you have to. So you have to be a war era veteran. You have to have lower income. And the last thing that I haven't hit on yet, but I am here because this is where it becomes very important, is that the pension, the calculations that the VA uses for pension, the last um, the last calculation they used is out-of-pocket medical expenses. And this is what makes the aid and attendance benefit work for veterans. And 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 so just remember, aid and attendance is not a standalone program. They have to they have to be eligible for non-service connected pension first. Aid and attendance mean the add-on is for it helps defray the cost of long-term care. And it really bumps the monthly benefit up to $2,100 a month. Um, so that is really is good, but that doesn't cover long-term care costs. So everybody's probably wondering, how does this work if it's only $2,100 max that they could get? Well, here's the scenario that works best for the non-service connected pension is that uh, is that they you have the veteran's spouse is, let's say they're in a skilled nursing facility, or they're in a dementia ward of a place. The veteran and spouse uh, are paying for it out of pocket. Let's say they have a house and they have 40, 50, $60,000 in savings of some sort. So they're right at the surface, they're not really eligible for Medicaid right now. So so this benefit can help the spend down of their assets by the cost, the out-of-pocket cost of the facility that they're in. Or if they're caring for them at home and they're incurring costs for the long-term care, okay? See how this works is that it has to be out-of-pocket medical expenses. So let's say the veteran and spouse together have, let's say, $3,000 of countable income. So without out-of-pocket medical costs, they would not have the ability to they would not have the ability to be eligible for this benefit. But let's say they're paying $4,000 a month out of pocket for the facility that they're in. So if they're paying that much, then the out-of-pocket medical cost is going to zero out their monthly countable income, and they would receive the entire $2,100 a month of the pension with the aid and attendance benefit. And that would help slow down that bleed down of their assets, still keeping the spouse in the house. And in these situations, this works for veterans and spouses, because it has that. Where this does not work is if the veteran does not have, they don't have any assets, they don't have a house, they have very, very limited income, and let's say they are in that dementia wing of a skilled nursing facility, is that Medicaid is going to be the better benefit at this point. Is going to be really their only option, because $2,100 from the VA is not going to do anything for them. If the veteran is already on Medicaid, by federal law, the VA would reduce the benefit down to, I think it's $90. So, but if the veteran is on aid and attendance before Medicaid kicks in, then the Medicaid, there is a sharing of expenses by the VA and Medicaid at that point. So this is a benefit that's really important to veterans who need somebody else to take care of them. And there has to be medical proof that they need help of another person, and it's just very basic. They look at the basic 5 ADLs, that everybody here, I'm sure knows quite well. Toileting, ambulation. I mean, those types of basic ADLs, and a doctor has to sign a form saying that they need help for all that. So aid and attendance with, the add-on with the pension for our war era veterans is a really important benefit, um, and not well understood. And I hope that I've explained this well for you, because this is a really important benefit, and something that you probably run across every day. And it can work to keep the spouse in the home for a while. It just depends on how long and how big the expenses are for the spouse that's in the assisted living. So it's 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 uh, it's like I said, it's a good benefit when net worth is above the Medicaid max. Um, I already did healthcare, so let's go back here. So I hope that if anybody has any questions, they'll type, they'll chat with me here, and I will answer them. But I am going to move off of this, the long-term care benefits and Medicaid. The VA has uh, the VA has uh, um, so the VA does have um, so the VA does have um, has this benefit for spouses, and we're going to talk about the surviving spouse benefits here in a minute. So let's move on to VA healthcare. Um, like I said before, not all veterans are eligible for VA healthcare benefits, um, and one of the misperceptions is the veteran may only receive care for a service-related condition. If you're in VA healthcare, they look at everything. They take care of you with a primary care provider, and they take care of a whole body health care. Um, and it's, again, not necessarily, it, it getting into VA healthcare is pretty complicated in itself, but once you're in, it's really good healthcare. And we always encourage veterans to apply for VA healthcare. Um, because if there's openings and you're not a disabled veteran, then they can let people in. So survivor benefits are not, just to be honest with you, is that there's not many survivor benefits. And there's a question here, and I'd like to, are free hearing aids available to all veterans? And the overarching answer is no. You would have to be in VA healthcare, enrolled in the VA healthcare. If you're enrolled in VA healthcare and you need hearing aids, they will see you. They will test your hearing, and if you need hearing aids and that's not a disability recognized by the VA, they might charge you a $50 copay to get them. But you have to be in VA healthcare first to get hearing aids. So the first survivor benefit is dependency indemnity compensation, and we call it DIC. And it really revolves around, and this is the better of the two benefits. DIC is a benefit for qualified dependent, and that means a spouse or dependent child up to the age of 18, or if they're in school, up to 24 years of age. But really revolves around that the veteran passed away from a service-related or a service-connected condition. There's two ways. Well, and the most common way is that, like my dad, who died from, he served in Vietnam. He died from heart disease from Agent Orange. And my Mom was able to receive this benefit because he passed away from a service-connected disability. And this is $1,250 a month from the VA. It's tax-free, and it's a really good benefit in comparison to the one below, which is death pension. The other way is, and this is the indemnity side of the DIC, is if they were considered permanently service-connected, permanently and totally disabled for 10 years preceding death. The survivor would receive DIC at that point. Um, Again, there's no income limitations. They could be a millionaire surviving spouse and receive DIC. It's straight benefit. Um, and when we have a surviving spouse in front of us doing advocacy work, this is the benefit that we really push for. See any way possible that they could get this benefit, because death pension is absolutely horrendous. The maximum that a spouse could get is $650 a month. Um, and it's an income dependent one. So every dollar of countable income they have, the VA takes a dollar away. And however, aid and attendance can be added on to the death pension. The veteran would have to serve during a war era, and the surviving spouse would be in need of assistance of another person, and that bumps that up from $650 to $1,200 a month. And again, that's not much, but if they have assets, that does help in that spend down of assets. So as you can see, there's not many survivor benefits out there. I'd also like you to know that we have 2 state veterans homes, one in the Dalles, and it's a 140-bed facility, and it has 3 skilled nursing and 1 dementia care wing, and it's located just east of the Dalles, up on a bluff overlooking the gorge. So it's absolutely a gorgeous place, and it's been around for about 20 years. Our other veterans home is in Lebanon, and it's been open coming up on 3 years now, and it's a 150-bed facility, and it's a community-based living skilled. It's a skilled facility also with a dementia pod. They have pods, really a unique design where each pod is their own community with their own kitchen and such, and it's absolutely a gorgeous place. And we will be building a 3rd veterans home in it's probably going to take 4 or 5 years for us to open it, and most likely it'll be somewhere in Roseburg or Southern Oregon. So they're great places that veterans and spouses can go to. A surviving spouse can also reside in our veterans homes too. So they're wonderful places that that we're very proud of. And that's the end of my presentation. I hope I covered everything I needed to, and I'm not sure how we're going to work the rest of the conversation, but I will stay on the line as long as people have questions.
If everyone would like, we can open up the line and unmute all the users so they could ask questions.
That'd be great, yes. That
Let's
would be
do
fantastic.
that. Let's unmute.
I have no hurry. I will stay as long as we have questions. So.
Okay, we do have the feature in the top, that dark gray bar in the top, where if you have a question, you can raise your hand. So if anyone would like to ask a question, please raise their hand and Mitch will address it. It looks like we do have a question. Aside from excellent presentation, thank you.
Okay. So I see Frank has asked the question of the percentage of the number of veterans who receive disability benefits. I can tell you that last year there were about 74,000 veterans who received disability compensation in the state of Oregon. And there is about another third of that receive pension, and most of those are pension with aid and attendance. And then next question, thank you very much. This is really good. When would you recommend Medicare for vets? Is, we're trying to reach out more to our elderly vet population to look at the possibility to get on the pension with the aid and attendance before Medicaid. Is that there are just as many scenarios that you work with people when you're out in the field, is that there are some veterans and family members who Medicaid is really the only option, is that they have no assets, they have really no countable income, and they need, and let's say long-term care or whatever, is that the pension with aid and attendance isn't going to do much for them at that point. Is that these are people that, if I'm going to say who do I recommend, is that if you're out in the field and you're working with somebody and they have a home, they have assets, they have a spouse, is that's the time, and this is my plug, and thank you for the question, Frank, is that this is the time to contact your local veteran service office, is getting them engaged to see if something like that pension with the aid and attendance would work. And every county has a veteran service office. So I would invite you to come to our website, which is www.oregon /ODVA.gov. And there's, right on the front of the web page, it says find a veteran service office, and you can find your local, whatever county you happen to be in, working office, and call them and say, hey, I'm from SHIBA, and I have a veteran here that really needs somebody to come out and talk to them. And that's their job. That's what they do. That's their passion. And especially talking about an elderly veteran couple, or maybe not, but somebody within your world that needs assistance. You guys are the partners that we dream about having out in the field or in an office working with people, is that please think about, ask them if they served in the military, and ask them if they've ever engaged with a veteran service office, or if they have VA benefits. Please involve that local help, those county veteran service offices. And then the next question is, are dental benefits available to veterans? And the larger answer is probably not. The VA has had some paid dental programs where it was like insurance, but even myself, who is service-connected, could not receive dental care through the VA unless the military caused an injury to my teeth or my jaw. And that's really, it's a very contentious point about with veterans in the federal VA, but it really boils down to money, and the answer is probably they are not going to be eligible for any dental care with the VA. So, William, thank you. Good to hear a Navy guy on there. Please engage as many people as you can into that veterans, advocacy portion that we do. We're representing right now about 120,000 people in the state of Oregon, our agency is. So we're very active, and again, that you guys are the tip of the spear for us. So thank you. Any more questions? Oh, here's one.
Okay, well,
Nope, here's one more. Do you recommend, the question is do you recommend Medicare enrollment for those vets receiving their medical care through the VA system? Yes, we do. And here's why. Is that if I'm a veteran and I live 10 minutes from the VA hospital in Portland, and I was in VA healthcare, chances are that I'm going to be well served by the VA. And maybe I don't have to enroll in Medicare. But if you live away from a major VA medical center, and I've seen this over and over and over, is that uh, not too long ago, actually quite a few years ago, a, a veteran that I talked to called, and I answered the phone, and he said, "Do I need to enroll in Medicare?" And and I said, "I recommend that you do because it gives you options." He lived down on the South Coast. There's a couple VA clinics. It's a pretty long drive to get VA healthcare in like a hospital setting from where he was living. 7 months later, he came down with cancer, called me back, and said the VA's requiring me to go here and there for my care. And I said, "Sir, I remember you. And you said, and you were actually kind of angry at me that you didn't want to pay the 100, whatever the deductible is for Medicare now. And now you don't have any choices. If he had Medicare, that the possibilities are is that he could find a doctor through Medicare locally and get care that way. So from our agency always recommends, with some exceptions, that everybody signs up for Medicare too. And I think that's the last of the questions.
Thank you, Mitch, very much. This was really informative, and we thank you so much for being such a supporter of the SHIBA program and
Oh my
partnering
gosh,
with us.
absolutely. I am in awe of what you guys do every day out there, and if there's anything you guys need, let me know. And again, thank you again for this opportunity.
And I want to echo your advice to reach out to the local veteran service officers.
Yes.
They are a wealth of information, and they are aware of the SHIBA program, and they have been
Yes.
very, very helpful. And I just have to give kudos to every VSO that I've dealt with that has just been extremely helpful with issues that are presented for their veterans. So
Yes.
thanks to your great
Absolutely.
team.
Thank you very much, and I wish everybody a great day, and thank you again for what you do.
Yeah, if you have further questions for Mitch, you can certainly send it to the state office, and we'll get them to him, and then we will
Yes.
send it out to the rest of the group. Thank you again.
Bye-bye.
Thanks, everybody, for joining us today. We hope you found this webinar of value, and we will continue with having subject matter experts presenting on a monthly basis. If you have suggestions, please let Miranda or me know, and we will try and get those folks scheduled. Have a wonderful day.